So prior to entering the room, I would review the medical records, make sure that I have an order to insert the NG tube. I'd also check the allergies and diagnoses to see if anything will interfere with the procedure. And then I would prepare my equipment before entering, and we'll begin. Hi Sally, my name's Shannon. I'll be your nurse today. Today I have an order to insert a nasogastric tube. How are you doing today? Good. Put this part over here. Lower that. Okay. Can you tell me your last name and your date of birth? I'll just go ahead and confirm that on your bracelet. Thank you. So today I have an order to insert a nasogastric tube. It's a tube that will go up your nose, down your throat, and it travels through your esophagus all the way down to your stomach. Before we begin, I'll have to check some vitals. And before starting, I would perform hand hygiene, and I would elevate the bed. And I want to make sure that the patient is in the high Fowler's position, which is 90 degrees. If they were in comatose, they would be in the semi-Fowler's position, and if they had to be supine, we would do it the reversed trimmed Ellenberg's position. So we'll be at a 60 to 90 degree angle. So I've performed hand hygiene. I'd go ahead and collect vitals. I would make sure that we check their SpO2. So just go on your finger. And we'll check blood pressure. We'll check the blood pressure, respirations, pulse, and their temperature. Pretend like we're doing that. Okay, make sure that you record the vital signs. And then afterwards, I would assess for cough and their gag reflex. Can you go ahead and cough for me? Then they would cough. Then I would check their gag reflexes with this tongue depressor. Open wide and say, ah. And you would stick the tongue depressor far back there until they gagged a little. And then before beginning, I would wear my clean gloves. So this procedure can be a little uncomfortable. It can take 15 to 20 minutes, but we'll work through this together. Just bear with me here. So I would put this cloth here. Push them up a little bit more. Okay, so you would open the tube packaging, put the lubricant here, and we would lubricate at least 4 inches of the tube, lubricated. And then I would go ahead and give the patient their water, because they will be taking sips of water as we insert the nasogastric tube. Okay. And then we want to give them the emesis basin just in case they happen to vomit as we're doing this, which hopefully they don't. All right. So we'll first measure the length of the tube. So I'd probably lubricate it after measuring, but we go to the tip of the nose, around the earlobe, all the way down to the xiphoid process, which is the end of the sternum. and we would mark that with some tape. And remember the measurement because you want to record that. That's right at 65 there. Okay, so now that we've measured, we'll start inserting the tube. Okay, so you start, oh, and before all of that, we want to check the patency of their nares bilaterally. Can you blow out your nostril on the left? Okay, do that again on your right. And we want to insert the tube into the clear nares. So the right one's clear. And we just keep inserting the tube. Once we pass the nasopharynx, we'll ask the patient to tilt their head forward, their chin towards their chest, which she's already kind of doing. And once we pass the nasopharynx, we want to check with our pen light to make sure that it's in the right area, which is the back of the throat where the esophagus starts. Okay. And then while we're inserting the tube, if the patient happens to cough, if there are any changes in the voice, and if you notice any leaking in the tube, then you would have to restart the whole process. Otherwise, if you do not notice any of those changes, proceed with inserting the tube to get to your marker. Insert. Sorry, this is really uncomfortable. Keep trying to take sips of your water. Just keep swallowing. Okay, we've reached our mark. So I'm going to temporarily anchor the tube. It's not sticking. Pretend like that's anchored. And then now we want to make sure that we inserted the tube to where it needs to be by listening to the epigastric region. So while I have that anchored, I will inject 30 cc's or milliliters of air into the tube. So you'd pull the plug out here, and we would get 30 cc's of air. Reassure that the patient's doing okay. And then we'll auscultate in the epigastric region where the stomach is, which is right in this left upper quadrant here. So as you inject the air, you want to make sure you hear a gurgling sound, which there was. So the tube is where it needs to be. Afterwards, we would aspirate some of the stomach content, and we're going to test for the pH. So you'll put the strip in your emesis basin. You'll take some of the stomach fluid out, inject it on your pH strip. It's right in there. Put the plug in. Then afterwards, you would anchor the tube, making sure that it's not, making sure that you're not pressing too hard on the nares. So we'll go ahead and do that. Oh, maybe I did it. I was wrapping the tape around. And then you want to use a clip to secure it to the patient's gown, or you can use tape. Okay, so once that's secured and anchored to the patient and they're comfortable, we want to obtain a chest x-ray or abdominal x-ray order to make sure that the tube is where it needs to be. And then also I would dispose of all of this. I'd take my gloves off. We would then take the patient to radiology for them to get the x-ray. once we have the confirmation that the tube is in the stomach, we would then bring the patient back to the room, put on a new set of gloves, perform hand hygiene before doing that. And then if the patient is independent, you can have them do their own oral care. Otherwise, if they're not, you would have to assist them with that. So, all right, Sally, go ahead and brush your teeth for me. So she's done her oral care. I'm then gonna clean the tube with mild soap and some water. And you'll just clean around the nares there and just kind of the end of the tube. You wanna make sure that the patient is in a comfortable position before leaving the room. So I would lower the bed to the lowest setting. Are you comfortable at this angle? And you wanna make sure that their call light is within reach. And thank you for letting me take care of you today. Is there anything else I can get you before I leave the room? No? Okay. Call lights in your hand here. Okay. And you want to make sure the patient's comfortable, dispose of everything to where it needs to be. And then afterwards, you leave the room, document all your findings, which includes the time, date, type of tubing used. You would also make sure that you document the gastric contents, so that includes the characteristics, amount, the pH, and then you'd document the x-ray report, and then what was the last thing? I'm trying to think of that, sorry. Gastric contents, characteristics. Oh, and then whether it's hooked to suctioning or if it's clamped off. And then that concludes it. Sorry for the delay at the end.